departments or religious.
We're talking to Ms. LWhitlow, and the topic is STD-Free Coalition, and Ms. Whitlow is the director of the coalition. And of course, Ms. Whitlow, during the final segment here, let's see if we can have you to further inform our audience of all of the positive things in a real sense that the coalition is doing and has done, as well as perhaps point us a way in which we might be able to further use the information that you've gathered.
Thank you, Dr. Haney. I can't talk about the positive things that STD-Free, the coalition, has been able to accomplish without talking about who our partners are. And specifically, our board chair is Melvin Bro with Project Hope, and then we also have members of our board from Hope Clinic for Women, and also the First Response Center that operates a wellness center and does prevention education as well. And the Metro Public Health Department, who is our contract agency, and the Department of Probation and Parole person sits on the board that is from that department, Metro Social Services also. We also have some individuals who represent radio stations. Sharon Williams, Sharon Kay, as she's known, is one of our primary persons that gets together with the coalition, and they've also done some hosting of some of our activities. By the way, which are National HIV Testing Day, that's one of our flagship activities. Also, something called, there's a lot of fun, called the STD Haunted House, which routinely, for several years, took place on the campus of Tennessee State University. That particular program is, in 2001, was the recipient of the Tony Cox Funding Award from the Cable Positive organization, and we're very proud of that. As well, that particular activity is replicated at sites across the nation. MTSU is a site that replicates that activity. The University of Alaska replicates that activity, and also a program, an AIDS service program in the District of Columbia, Washington, D.C., replicates it also. STD-Free is is a model program of the Centers for Disease Control, and because of that, it is also replicated, the program itself is replicated in Memphis, Tennessee.
And so you're having an impact not only over the state of, not only in Nashville, but over the state of Tennessee and nationally in a real sense.
Well, I think that to the extent that that has happened and we've gotten some national recognition has been because we have had strong national partners. Project Wave was one of the partners in which resulted in Project Wave Nashville here, which was a partnership between radio and STD-Free, basically. And what we were able to accomplish with that was, I think, something that was kind of historic, and that is 3 urban radio stations who are fiercely competitive, sharing a stage under Sharon Kay's leadership and hosting to address the issue of HIV. And I don't know when that's ever occurred, and it happens every year at our National HIV Testing Day activity. So we're very proud of that as well. And
so in a real sense, you think that you might be able to bring some of the things that you're doing with STD into the HIV issue.
Well, we work with both issues. HIV, of course, is a sexually transmitted disease. So when we're working with syphilis and talking about chlamydia, we're also talking about HIV and AIDS as well. And I think that's something that's a little bit different from maybe some of the AIDS service organizations here in the city that have a primary thrust that's related to HIV and AIDS specifically.
And of course, Ms. Whitlow, the reason I say that is because I guess I've been talking to most of the individuals who have a primary concern with AIDS rather than say, even though, as you indicated, that it is an STD. But I guess, and for the most part, most of the pictures that have been painted in reference to this disease are very, very pessimistic kinds of pictures, which is to say that it's getting worse, and it's especially bad, HIV, I mean, and especially bad within the African-American community. And is that any validity in reference
Absolutely, and I think that it is something to be very concerned about. I think that there's less of a concern for sexually transmitted diseases, but one of the reasons that sexually transmitted disease in relation to HIV is so important and so important to be concerned about is because sexually transmitted disease, a person that has a sexually transmitted disease is more likely to get HIV or become infected with HIV, particularly syphilis. It facilitates very easily the transmission of...
It's a gateway.
Yes,
Kind of
absolutely.
situation.
Yes.
Very good. And